I'm with Dr. Suzy Feigofsky, who's an electrophysiologist from Carroll, Iowa, as part of the Iowa Heart Center. This summer, Dr. Suzy and I actually traveled to a remote island called Batiki off the coast of Fiji to provide medical care to natives who've never seen a doctor. Dr. Suzy, welcome to the show.
Thank you.
Tell me what inspired you to go on this trip to Batiki, because we were in the middle of nowhere for weeks.
We were, and I think, well, besides you asking, and I can't ever say no, I think that I personally was in a place in my life where I felt very restless and unsettled and really wasn't finding my purpose as a human and also as a physician, where I really want to make sure that I am doing something impactful, that my family can be proud of, my children can be proud of, and I can be proud of.
So I know, because I was there with you, just how hard this was. You know, no running water, no real power, not a great place to sleep. Those were real challenges for me as kind of a Westerner. What was the most challenging thing for you on Batiki?
Actually, it wasn't the living conditions. It was the interpersonal interactions that we had with other volunteers. So we went there with people we didn't know. We were fortunate enough to know each other, but trying to manage personalities to make an impact and streamline that impact and be effective at it, I found that challenging when you have people who don't have the same beliefs about traditional medicine as you do. Not the islanders per se. I think that was the most challenging part, was learning how to manage people who may not necessarily feel they need to be managed.
I would agree with you. You know, that trip changed my life, changed the way I look at medicine, changed the way I look at my patients, my colleagues. What was the most impactful thing? What did you learn most from your time on Batiki?
I learned that I'm doing what I'm supposed to do. It also helped me to focus my career when I came back, to focus on the things that I find that I'm passionate about and really good at, and eliminating the things that I'm not so much interested in. I think I learned to say no, to focus on things that make me happier and better. And I think going there helped me gain the confidence to do that.
Why is it important for folks like us who are members of HRS to go and do things that are way outside our area of expertise and volunteer on medical missions throughout the world?
Well, I think we're unique as far as HRS goes. They're very supportive of global missions, and I think that is part of the mission of Heart Rhythm, is to end suffering around the world. And so what was unique to us is that we didn't go providing electrophysiologic care. We went and provided general medical care. And I think even that is important. I think we are so fortunate to have everything that we have, and I feel it's our duty to give that back to the people who are less fortunate, who happen to be born somewhere in the world that doesn't have the luxuries that we have here in America. And I feel that everyone within their means should do something to give back, whether it's volunteering at a shelter in your community or volunteering at a free clinic. Doing something to give back, I think, is priceless.
You know, I think that our time on Batiki taught us much, and I think if I had one piece of advice for people that want to go and do a medical mission, it would be, it's going to be harder than you think it is. What would be your piece of advice for anyone here at HRS who wants to get involved in a medical mission?
I think you need to go into it with an open mind. I went into it with no expectation, zero. The fact that we had a roof, I was ecstatic about. So I think if you go in open-minded, then you don't allow for disappointment. If you go in with no expectations, you will come out with an amazing experience.
I think that's great advice. And, you know, to your point, you and I are going to go back this year.
We are.
I can't believe we're going to do this. So we'll be back in the southern Lao off the coast of Fiji, and I'm looking forward to it. Thank you so much for being on the show, and I look forward to sailing in the open waters of the Pacific with you this summer.
Yeah, there's a lot of ocean and not a lot of anything else, so it'll be good. Thank you for having me. I appreciate it.